So now that I'm about halfway through the PowerPoint, I thought I'm probably losing your guys' attention by now, so why not put something in to kind of regain it. So here's some of the snakes that I actually hatched out this summer over clinicals. If anybody's interested, sorry if you're freaked out by them. So tests to rule in, we've got cerebral computed tomography, and that's the gold standard test. Otherwise, MRI is also really good. And then you also have the intrathecal infusion test and the ventricular infusion test. And of course, PTs cannot do any of these. So I included this slide to kind of give you a good view at diagnostic criteria for NPH. I kind of like the one on the left-hand side more because it includes people from 40 years and up. Otherwise, the one on the right only goes from 60 years and up. So you're kind of losing 20 years of patients there. And I don't think that's worth it. Some related disorders. So Alzheimer's, Parkinson's, multi-infarct dementia, cervical stenosis, and lumbar stenosis. And then I also included a chart in here where it gives a bunch of different characteristics like symptoms, diagnosis, medical management, prognosis. Check it out. Some impairments. Those are going to include all those gait disturbances I was talking about before. So bradykinesia, apraxia, shuffling, shorter stride length, broad base of support, etc. Also, impaired cognition is going to be a big one. Functional limitations, this is going to include if left untreated, it can actually result in a patient being bedbound and non-ambulatory. So you really want to identify this quickly and refer out for MRI or the computer tomography as soon as possible. Also be looking for urinary incontinence and problems with transfers for the functional limitations in this population. And then overall, just problems with ADLs. Treatment. So it's kind of more out of our scope, but implantation of a cerebrospinal fluid shunt. And that's it's a shunt that goes from the brain and then it connects a tube all the way down to your stomach where the CSF drains to. And then there's also a lumbar drain where they do a lumbar puncture and drain out the CSF fluid in your lumbar region. So what is our role? Any patient presenting with signs of NPH should be referred for a cerebral computed tomography ideally, but then typically you're going to want to assess the patients before and after their surgery, and then you're going to want to determine the gait and balance improvements. So perform a baseline evaluation and make sure that's done before the drain placement, and then document progress daily. I also included the consult sheet for a hospital at the bottom here, so you can kind of look at what physical therapy's role is at that hospital. And then our treatment goals, basically just to make them independent with the ADLs, get them back home as quick as possible, and help them out with any toileting issues that are remaining. And here are my references.